All right. Good evening. Good evening. Welcome all who are streaming live right now. Tonight is all about COVID-19 Research Study and Minorities. Is it safe? That is the biggest question a lot of people want to know. So I'm super excited to have this conversation tonight. Thank you to the University of Maryland School of Medicine Center for Vaccine Development and Global Health for helping us put this whole thing together, this amazing candid conversation tonight. We have great panelists. First, I want to introduce Dr. Karen Kotloff, who is a professor of pediatrics, medicine, epidemiology, and public health at the University of Maryland School of Medicine. How are you?
I'm fine, thanks. Good evening.
Good evening. So let's prepare everybody for exactly what you do in your experience with everything to give us some good background about you.
Sure. So I'm a pediatrician. I'm head of pediatric infectious disease at University of Maryland, and I am associate director for clinical research. So I've spent most of my career studying infectious diseases that could be prevented by vaccines and studying vaccines that might work to prevent these terrible infections. So when COVID and I work both in internationally and in Baltimore, and when COVID came along, I was asked to lead the studies, and I'm leading two of the COVID vaccine studies associated with the NIH.
We have lots of questions for you. Okay. Next, I would like to introduce Reverend Deborah Hickman, who was the co-founder and CEO of Sisters Together and Reaching. Good evening. How are you?
Good evening, Persia. I am wonderfully well.
Good. So let's give information about yourself.
So a little information about myself, as you've already stated, I'm the founder and CEO here at Sisters Together and Reaching. I am also an assistant to the pastor at the City Temple of Baltimore Baptist Church. I serve on a lot of committees over at Johns Hopkins, as well as I serve as a consultant to Dr. Kotloff relative to COVID-19 research. And so I'm also a human volunteer that, signed on for one of the studies, the vaccine studies, because I feel as though it's the most important thing that one can do for the lives of their family members, friends, as well as all of humanity to try to keep us safe.
Absolutely. I am very excited, ladies, about this education, an eye-opener as a community that we will receive tonight. So let's do it. COVID-19 vaccine research, like many others, is said to need to include a diverse group of participants, including, members of the Black community. Why do we need this diverse? Dr. Kotloff, let's talk about that.
Yeah, so we know a lot about who COVID affects the most. And we know that COVID isn't a democratic virus, that it tends to affect people more who have risk factors, who are older in age, who have underlying medical conditions. And also minority groups are affected more, both getting more infections and having more severe disease. And so when we're developing vaccines, we want the vaccines to work for everybody who is at risk. And so it's very important that we include all of those groups, just as they're represented in the population in our studies.
Yeah, we have had some bad history in medical research involving African Americans, such as the Tuskegee Institute. What makes this different?
Do you want to take a stab at that, Deb?
Yeah, I think what makes this different, Persia, at this moment, we're 91 years in front of what happened in Tuskegee. And we have in place persons that look like you and I that are part of the Data Safety Monitoring Board that monitor the safety and making certain that protocols are in place and that everything is done ethically, and making certain that if there is a glitch that it is halted right away, and checking in on people, making certain that the providers, when they actually have the conception for these vaccines, for these research trials, that they are actually making sure every I is dotted and every T is crossed. And so I think that we're different now than we were then. There's a lot of monitoring around everything that takes place, down to the providers themselves cannot participate in their own research study.
Yeah, and Reverend Hickman, as an advocate for the minority community, I feel like this definitely is very important for us to be a part of. But like, what is the most important piece for you that the minority community is a part of this?
I think the most important part of it for me is that we have done our own research before we actually say yes to participating, and that we know the right questions to ask. We want to know, what is this actual drug that you're going to inject into my body made of? Are there any live parts of COVID in there that could do me harm? And what does it mean to say that the Moderna vaccine has a messenger RNA? Will it affect my gene pool? Will it change my genetics? You have to ask all of those questions. Will it impede upon the medications that I take for my hypertension? Will it actually cause me to not be able to have a child if I were fertile? Thank God I'm not at this hour. And so therefore, it's just those kinds of questions that you can feel good about asking. What happens if I actually have an allergic response? How are you going to be able to make certain that I get the appropriate care? How are you going to make certain that you're going to stay with me through that process? And will I be able to come back into the study, or will I have to step out of the study based on what my medical conditions are? So those types of things, I think, make me feel safe. They also, I think you should go and visit the place where you're going to actually get the injection, so that you can get to see and become familiar with how things are set up. Is it set up so that it's clean, it's sterile? Are the nurses and the doctors and the techs there paying attention, speaking with you, identifying themselves, letting you know step by step what is going to happen? Are you going to be giving me something so I can monitor myself daily? How frequently are my visits going to be? What should happen if you don't have the next dose that I'm supposed to take as a part of the vaccine trial?
Yeah.
Where do I stand? Asking the questions of, will this cover me if I come in contact with someone that actually has COVID? Or do I need to really stay home more so now that I have stepped into this vaccine?
Absolutely. And for everybody joining now our live stream, COVID-19 Research Study and Minorities, is it safe? I wanted to remind you, you can actually comment, ask questions, and the experts can answer them for you. So just type your comment and we'll hop it up here. We'll say your name and exactly what your comment is. We have one right here, Desiree, Tuskegee and Henrietta Lax. Couple of Direction 45 that I've heard is causing great hesitation in my community. Can we speak on this?
Yeah. Karen, you want to take that one?
Sure, yes. So these are bitter memories of really of neglect by the medical community and the research community. It's neglect and it's failure to transmit the essential information that people need to know to make the decision to participate in research. So, Reverend Hickman mentioned some of the safeguards that are now in place. But I think that there are a couple of things to think about. One is that research is now highly regulated, and a lot of that is in response to some of the terrible things that happened in the past. So, what we do as part of the process is we educate our volunteers in as much as we can. And this takes the form of, one, there is an informed consent form, and that goes over in extreme detail why we're doing the study, what are the risks, what are the benefits, what don't we know, what happens if we get new information once you're in the study that could affect your decision to stay in the study. And that was the cardinal sin of Tuskegee, is that new information came about and that wasn't conveyed to the volunteers. And now all of these kinds of things, every step of what you do to participate in the study is spelled out. And we give that vaccine to all our volunteers before they even come to our site. And then once they're on their site, because we understand some people take in information reading, some hearing, there are different ways that people understand and take information. So then all of our participants sit before they make the decision to participate, and they watch a video that's about 15 minutes. And that goes over these most critical parts of being informed to be able to make a decision about participating. And then they come in a room with us and we say, tell me what your questions are and we'll answer them. And, we are being overseen by ethics committees, by the FDA. And so I think that there are so many safeguards in place. And I think the other thing that you can do is look around and see who's next to you. I mean, we have an extremely representative population of volunteers who come in to our studies, and they're all treated exactly the same. Um, and then finally, what you can see is that of the first two studies that were done with results, thank goodness they worked. And so you can also see what the result is of doing this research and why we're doing it and what the product is. And if they didn't work, that's why we're testing a number of vaccines, because we're trying to cover for that potential risk, because our goal is to get a safe and effective vaccine to the population to stop this pandemic.
Absolutely. That is the ultimate goal. We all want that, right? Like, and all of us get affected by it. So I know that the scientists will do this and all the study that is happening and the research, their family, their friends will get this vaccine. So why would they implement that into their family and friends' bodies? So of course, they're going to come up with something that we can all benefit from. And,
Yes, you're welcome, Desiree.
Hey, Desiree. Okay, so we have another question up there from Mrs. Henson, I believe. It went away. Oh, there we go, Lisa Henson. With the disparity and equal health care for minorities, how can we trust medical professionals to give us honest information? And I think you spoke a little bit about that, but if she missed some of that, do you want to recap how we can trust that we'll get honest information?
So Lisa, this is Reverend Hickman, and I'm going to tell you how you get honest information is first, you yourself must have some background. You must take your time to, read and understand what it is that you're going to your provider for, be able to ask the questions, as well as that you can call the CDC hotlines. You can call Baltimore City Health Department, and also the state has a site up if you're unsure about what is being spoken to you. Never just, if your gut is telling you this doesn't sound right, then you should actually get a second opinion, a third opinion. But you have the right to ask and make certain that you yourself know. Don't just go to church and allow the pastor to tell you that you're going to go to hell if you don't put your money in the plate. You have to actually understand that that's not the will of God, but that's the will of man. And so the same way when we walk into the church and we, listen to somebody, you go home and study for yourself. When we leave the doctor's office, go home and study for yourself. One of the things for me, if I am sick and I go to my doctor's office and I tell them I got a pain in my stomach that I can't get rid of, and they said it's probably nothing, but you might have a urinary tract infection, I'm going to give you this prescription. If it doesn't work, you come back in a couple of weeks. I'm not coming back to you at all, because of the simple fact that you did not take time to run the tests that were necessary to determine whether or not I need the medication that you're now prescribing for me. You're making us, I think you're making a lazy decision. You just want me out of the way. And so I'm not coming back to you. I'm going to seek out another provider that will listen, as well as make certain that I take the appropriate road before they give me a prescription.
Yeah, absolutely. I agree 100%. And I think the biggest thing out of that is research and doing your own research as well, because you can hear something from somebody else, but why not look it up for yourself? Just kind of know what you're getting, what you're receiving, and asking questions too. Because a lot of people just go and do something without actually knowing the facts about what is going on. And that's why I'm really excited about this candid conversation tonight, because there's a lot of people that have lots of questions, like Lisa and Desiree, and they're going to answer tonight. So thank you again, ladies, for being a part of this. I'm super excited for more information. Lisa, you are welcome. That was the answer right there.
Very welcome.
Yeah. So Dr. Kotloff, you've already actually been in this research study. You've actually taken the vaccine already, correct, right?
So I was not permitted to participate in the Moderna was the first vaccine that I tested.
Okay.
I wasn't allowed to participate in the study, but once the EUA, the Emergency Use Authorization, allowed it to be publicly available to healthcare workers, I rolled up my sleeve. I got my first dose. I'm getting my second dose the second week in February, and I almost cried when I got that dose.
It's like,
You do all that work and pray and hope that this vaccine is going to turn out, because vaccines are such a useful public health tool to they're a tool that has equity, because if you can vaccinate the whole population at risk, then they don't get the infection. You don't have to worry about their access to health care. It is a way of dealing with public health in the most fair way, in my opinion. And you're not treating somebody who got sick, you're preventing them from getting sick. And that's it's just better. Who doesn't want to not get sick?
right.
So I was the second that I could get that vaccine, I signed up and rolled up my sleeve.
Yeah. You know, what's been crazy is I've been hearing a lot of people say, you know what, I'm going to get the vaccine. They said, because I don't want to get sick. And the numbers are spiking in COVID-19 here in Maryland. And a lot of people who are nervous were like, listen, I got to go to work. I have to be around all these different people. I have to go to the grocery store. Like, you know, I'm around my children. I'm around the elders and my parents, my grandparents. Like, I have to do what I have to do for myself, my family, and people around me. And I think that's been the biggest thing. So people have probably had the same response as you have, doctor, as well, you know?
Absolutely.
Yeah.
Absolutely. And you brought up, are there side effects? Because I think the other thing, we're talking now not about vaccine research, but about getting the vaccine and dealing with your concerns and hesitations about getting the vaccine. And I think that for each individual, you're weighing the risk and benefits for yourself. And I think you can make a list of what those risks and benefits are. So, are there side effects to the vaccine? There are side effects to vaccines, because to give people immunity, you have to kind of wake up the immune system and give a little bit of inflammation. That's how your immune cells process um, new information and develop immunity. And so, after you get this vaccine, you might have a sore arm, you might have a headache or fatigue, and I think that's where flu got its reputation. That I get the flu vaccine, it gives me flu. That's not flu. You don't have any living virus in your body. It's just some inflammation. It's the inflammatory response that your body makes, and it turns off quickly in a day or two. So that's the risk. And what's the benefit? Do you want to have COVID and risk the horrible consequences of COVID? Do you want to hopefully have immunity that protects you from being able to spread the vaccine to other people? We don't know that for sure, but that's the hope. And then when enough of the population becomes immune, it's like building a wall. The virus doesn't have anybody else to infect, and so it dies off. And that's kind of the concept behind what we call herd immunity. So they're the benefits. And take the information that Reverend Hickman told you about. Talk to your family. Take your time and make these decisions and weigh the risks and benefits for yourself.
Yeah. Okay. We have another question from Joanne Morrison. Reverend Hickman, I understand you received the vaccine and the research study. How was that? And did you have any side effects? And I'm happy that Joanne asked that, because I wanted to ask you that as well.
I did sign on for the Novavax study. That is actually a drug that's being tested. It's in phase 3. And the company that's making the drug is right here in the state of Maryland, in Gaithersburg, Maryland. And I am coming up on not this Saturday, but next Saturday, I will get my second injection. It was an excellent experience for me. I came to the door teary-eyed, and you're going to make me a little teary-eyed right now because I really feel very strongly about people, about us, and that we need and deserve to protect ourselves and our families, as well as our friends and others that are losing. Little children are losing their parents and their grandparents. And so when I got to the door, I actually ran into an old friend that was there to also be a part of the study, and he used to be one of the commissioners of health. And so I was just like really happy to see him. But at the same time, I was impressed by the volunteer. I think he was a volunteer that, did an assessment to make sure that I didn't have a fever, that I hadn't been in touch with anybody with COVID, that, all things were going to be well. And after he did all of that and I answered his questions, he escorted me to a room where I could watch the video again of what they had sent me. They sent me the consent form to review and call back and ask questions. Didn't have any questions, but I came with my form signed, and I could come with my form signed all I wanted. They wanted to make sure that I sat in that room and watched the video of what was going to take place, what was on that consent form, word for word. And then after that, they took me to another space, which was really open, and all of the nurses, the techs and the like, the doctors were there. And they told me then, okay, so you're going to have another medical assessment. And then after that, we are going to draw your blood. You're going to learn how to give yourself a COVID test in case you actually demonstrate any symptoms. And that, we will go over all of these things, show you how to take your temperature at home every day, show you how to use the e-diary to record your temperature, to record any symptomatology that you might have, and gave me a packet with a folder, a bag with a folder in it that had instructions of who I was to call if I was having sickness in any way, shape, or form, any time of day or night. And so for me, the process was genuine. Each person I came in contact with, I wanted to hug them. They seemed like they wanted to give me a hug as well. They had photographers there that day that actually, Joan Larson and her crew were fabulous. They asked permission to actually record me getting my blood drawn, to getting my injection in the site, as well as ask me the questions of why. Every person that talked to me took their time to, make certain that I understood what I read, make certain that I knew how to use the e-diary, who to call and the like, as well as after they gave me the injection, I had to wait then another half hour to make sure I wasn't having any reactions. And then they checked on me the next day and, get emails. Oh, you haven't completed your diary yet for the day. Please make sure that you've taken your temperature. Please make sure you're recording if you're having any symptomatology at all. It was excellent. I did not feel like I was being judged. I did not feel as though there was, any air of racism involved. There was a good balance of black and white. And it just was really a good experience. And it left a good feeling in me. Everybody should have this experience to know that no one has to die without trying your best to mitigate slowing down this virus.
So you were a superstar when you got that vaccine, honey. The cameras were there, the lights and the action. Yeah.
You got it. But I looked horrible that day because I was like, it's a Saturday morning, early 8 a.m. I could just throw on a quick pair of leggings, drop on a sweater, and they love the sweater. It's just like everybody kept saying, I love this sweater. But I was just like, well, I'm not here really to be, on a fashion runway right now. I'm here for life. Yeah. I'm here about everybody's life, inclusive of mine. And I have 3 beautiful children, 4 grandchildren, and a great granddaughter that I want to live as long as I can, Persia. I have always desired that at an age of 120, that I would still be as fabulous as I am at 65. Yeah.
The folks love you. Shout out to Marcellus, who said you're looking great. Okay.
Oh, Marcellus, I love you. I'm so glad you're listening in.
So let's talk about also right now. What would you say to the people who say the vaccination and the vaccine has been developed too fast? Because there's a lot of different studies, but it seems like it might be coming a lot faster than what we are normally used to. So what would you say to that?
Are you asking me?
Dr. Karloff, if you want to respond, and then Reverend Hickman, whoever want to, Dr. Karloff, you want to go first?
Sure. So there's a very specific way that the FDA requires vaccines to be developed. First thing you have to do is test them in the lab and actually in animals to see if they're likely to be safe and effective, at least in those models of the infection. And then if that's the case, you apply to the FDA and you start out with a phase 1 study. And that is a small study in healthy adults. And you just get an overall idea about, are there any side effects that I need to worry about? Does it give the immune response in people's blood that you're looking for? And if it passes that, you go to phase 2. And phase 2 is larger groups, and it starts to include the population that will be the target. So you may include young and old people. You may include people who have some underlying conditions as long as they're stable. And you do those studies in a little bit larger group of people. You kind of look at the optimal dose and how far apart it should be. If the vaccine passes that, then you go to phase 3. And the goal of phase 3 is you take that vaccine to a population that's getting infected. And you give half the people, or in the case of the Novavax vaccine, 2/3 of the people get vaccine, and then the remainder actually get a saltwater placebo. And that tells you whether you observe them over a period of time, and that tells you whether the vaccine is protecting people. Because if people who who are vaccinated get fewer infections, then you get the answer. Now, you've heard over time that usually takes years, and in this case, it took months. Mm-hmm. It really made records. And why was that? One is that there are so many infections in the community that there were a lot of cases, and you got to compare the vaccine group and the saltwater group very easily, because that went.
Okay, while we wait for Dr. Kotloff to hop back on, Reverend Hickman, do you want to? Oh, there we go.
Oh, okay, sorry. So the U.S. government poured a lot of money into manufacturing these vaccines. So normally what happens is that the pharmaceutical companies wait till phase 2 or phase 3 before they start building their facilities to make vaccine. But Operation Warp Speed made this happen at the same time, and that had a huge impact. And the government in this case took the risk, because if the vaccine didn't work, they'd have, these facilities would not be used. And that also made things happen very quickly. And then finally, it was kind of one after another. It wasn't like phase 1 and we're not in a hurry. We wait a couple months, look for more funding to be able to move to the next step. This was a very, very efficient process, but no steps were skipped. We went from the laboratory to phase 1 to phase 2 to phase 3 without skipping any steps. And then the other thing that happened is that the vaccines worked really well. So a lot of that time period goes into vaccines not working so well. So you change them a little, you go back to the drawing board. These vaccines work, and we're really lucky.
Yeah, and I think that's what's really important to be a part of these research studies, is because everything happened so fast, like it hit us hard. when we got the COVID-19, and the pandemic shocked everybody. So to be a part of this history and to help out, like, you know, the elders and to help out your neighbors and the kids and things like that to try to find a solution, I think is so empowering too. Like, you know, when you think about it, both of your responses, I mean, you know, Reverend Hickman, you said you did it for the people. Like, you know, you did it to help out other people, of course, yourself as well. And you want to live to 102 to look just as amazing as you are, you know? So that is why it's being done. And I'm really excited for everybody who has participated in the COVID-19 research study and people who will continue to do that as well. And that is what it's all about tonight. Is it safe to be a part of this? Reverend Hickman, for those people in the minority community who are also question, you know, has this happened too fast? Is this safe? You've been a part of it. What would you tell those in the minority communities?
I would tell them it hasn't happened too fast. I would agree with everything that Karen has just shared. I would say that they would be safe and that, you know, at this moment and at this hour, everybody needs to step up and we need to stop decrying about racism and all of the things that happened 91 years ago. And we need to be concerned about our family members and each other, that we actually can actually take this virus, but we have to actually be willing to step up and volunteer. We have to make certain that we are doing the things that we need to do. We can't go out and party like we used to. We can't go and be with our families like we used to. The saddest point or the saddest thing that is taking place is loved ones can't go to the hospital and get admitted and think that their family members are going to be in the room with them. That is the saddest moment when you cannot bring closure with someone that you love. The last time you saw them, you took your daughter to the emergency department because she was bent over in pain and you couldn't go in with her. You couldn't stay there. And now your 32-year-old daughter, who was a wife as well as a mother, and she's gone and they never got to see her. 3 weeks go by, she's in there in the third week. She's gone.
Yeah.
That's sad. That's devastating. And so we need to wake up and not be selfish and not be afraid. And I think that we need to trust. And I think for me, my daughter, my youngest daughter always says to me, what you speak is what comes to you. So if I'm speaking negativity, negativity is going to come to me. And I believe that. I believe that we need to get up and be positive and strong and know the facts before we go and make a firm decision to step in, save self, but more so save your family, save your friends, save us.
Yeah.
Save us.
Going back to your conversation that you were, the point that you made about loved ones being in the hospital, I've told my story a few times. My mother was just recently in the hospital, actually, when the pandemic first hit in March, and she was there for probably about 2 months. And I could not physically be there to hold her hand and to kiss her and love up on her. That was probably one of the worst experiences I've ever faced. You know, had my mom there. Shout out to the doctors, though, that really were great, and the nurses. They FaceTimed me a lot, so it was great connection, but it wasn't that connection. So in that moment, I wanted more than ever to help find a solution to this and to be a part of the research studies so that we could find answers so that we can be with our loved ones at difficult times, like, you know?
And that's critical.
Yeah, absolutely. Let's talk about the vaccines that are currently available and that will be available right now. Yep.
Yeah.
I should say, like, Doctor, come on about this.
So, sorry. So right now there are 2 vaccines, sorry, that went through what I call the phase 3 studies.
Okay.
And got what we call emergency use authorization. An emergency use authorization means that we're in the middle of a public health emergency, and this product, this is an FDA procedure. There is no other way other than this product to be able to stop this pandemic from going on, and the product looks safe and it looks protective. But there is, a bigger burden of proof that goes to licensure. So they want to be able to watch people who got infected for a longer period of time. They want many more details. So this is an emergency way to get a product to the population while a little bit more information is still being gathered.
Yeah, so Dr. Well, but since we have these other vaccines available, right, from these different companies, why do we need more research if we have these different vaccinations already available?
Right. So there are now 2 vaccines that have gotten emergency use authorization. That's the Pfizer vaccine and the Moderna vaccine. They're both messenger RNA vaccines, and they were both highly protective, 95% protective. So a lot of people ask the question, well, we have these 2 vaccines, why can't we just stop?
Mhm.
And the reasons are that 2 vaccines are not enough to be able to cover all the people in the world and even all the people in the United States. There's only so fast, that each vaccine can be produced. And so we need to have more vaccine. And then as we're learning the best way to prevent these infections, we want to be able to have different approaches so that if one vaccine fails, we have another type of vaccine that might work. Or if we find out that one type of vaccine maybe doesn't give protection for as long a period, we have another vaccine that might give protection for as long a period. And then we have some of the vaccines require deep freeze. And so they require highly sophisticated places for storage. Other vaccines, like the Novavax vaccine that Reverend Hickman took, only needs refrigeration. So there are different vaccines that might be appropriate for different situations. And right now there are plans to test 6 vaccines. 5 of them are in clinical trials right now. We're going to know about 2 of those within the next couple weeks. And then this will be a couple months, the Novavax vaccine. So then we'll have a whole army to fight this pandemic.
Yeah. So I also have another question from Ali. It says, can you touch and discuss on the importance of reaching communities of color on the COVID-19 vaccine and research? So do you want to talk about that, Reverend?
So touching on the importance of reaching our communities is making certain that we're being culturally sensitive in the messaging that we put out there, and that we are unified on the messaging that we're putting out there, and that we actually come into the communities to garner persons that actually can help develop those messages that are around the messaging that the state is putting out there, so that we don't confuse our communities, young, old, whether we are Black, white, whether we're Latino, Asian, or Indian. We all need to make certain that at this hour, this virus is impacting all of us. It is not just one group of people, but it is highly impacting our communities in spaces and places where there's some that are saying, I'll never get the vaccine because no one is caring about us, because they're out on the street corners and they are doing the best that they can every day to live, but how they're living is in housing that actually has multiple families in it. So we're doing everything we can right now to work together, unified across the universities and the like, and putting together those messages and calling on the governor to right now bring, the health officers and the commissioners of health to one meeting, so that we're not putting out different messaging, but we are working together to put out the same messaging that everybody will be hearing in different formats according to their culturalization of how they understand and how they learn, how they hear, and how they are able to be respected to answer their questions.
Yeah, Reverend Hickman, people have said that we need to reinvest in our communities, into social services, into people having access to adequate public education, people having access to adequate health care, people having access to healthy food. Do you think these are some major issues that play a big part in the lack of health education in the minority communities?
I do think that it is a big issue. And I think again, I'll keep saying it's a matter of how we are messaging, how we are taking the time to educate, how we're making sure things are written at a readable level. And if persons cannot read, for them not to be ashamed to say, I don't understand, I can't read this, so that we can bring them into organizations such as Sisters Together and Reaching and set them down at the table and read with them and let them know that we care about them. I think food is an issue. We've been participating on a weekly basis of going and picking up food at the door and making certain that that food gets delivered to people, not asking them to come and get it, but actually calling our clients, calling persons that clients themselves refer about. Miss Nancy's living over here. Nobody comes to see her. She's in the house and nobody's knocked on her door. So I think those are real concerns that we have to deal with, and we cannot leave any stone unturned at this hour, because people have lost their jobs. People are losing their homes if they have not been able to take their stimulus dollars and pay down on their rent and or pay on their gas and electric. We need those persons that actually know how to teach people in community to budget. We need you to come out and teach persons that when they get those stimulus dollars, it is not to go to the store and buy new clothes, new shoes, new hair, or any of that. It is to make certain that you are putting those dollars to your gas and electric bill or on your rent, because we're not certain as to how long there's going to be a moratorium on BG&E and on your rent. And so these are emergency crises that are going on, along with trying to stop the virus in its track by getting persons to get vaccinated or participate in these trials. We have to be looking out for each other, front, back, and on all sides. We have to do the things that we need to do.
Absolutely, Alicine. Thank you. Yeah.
You're welcome, Ellen.
Dr. Karloff, so I heard that the virus is mutating. Will this mean that we're going to need a new vaccine, which means more trials?
So hopefully not. I mean, we are following this very, very carefully, and all viruses mutate. So this is something that we expected. And there are lots of different kinds of mutated viruses that are out there. There's no evidence right now that there are enough mutations to affect the vaccines as they currently stand. It's possible that in the future this could happen. The reason that we have to give a flu vaccine every year is because that virus really mutates frequently. And so we have to make a new vaccine every year. Right now, there's no indication that we have to do this for coronavirus, but that is something that the scientists and the companies are prepared to tackle if it becomes necessary.
Yeah, and also, doctor, right now we're in different stages when it comes to your profession. You'll get the vaccine and or age, right? If you're a part of a research, do you have to be a certain age? Do you have to have some profession, or can you just go and say, I want to be a part of this research?
So the only qualification, there are two qualifications for the current studies. One is that you have to be an adult, at least 18 years of age. Pfizer went down to 16 years of age. And then two is that you can't have a suppressed immunity or an underlying disease that is not well controlled. You can have a stable underlying medical condition. They're the major reasons why you wouldn't be able to participate. That will change in the future so that there are trials that are planned for children, going very carefully down in age. And there are trials that are planned for pregnant women. And then it's also possible that pregnant women, if they felt, because pregnant women can have more severe COVID. So if they talk to their doctor and it's decided that their risk is enough, they should get one of these vaccines. That's acceptable to do also. And then in terms of people who have weakened immunity, We are accepting in the trials people who have HIV, who are stable. But if people really have a weakened immunity, we need to learn specifically how well the vaccine works in those people. And it may be that other preventive measures, such as what we call monoclonal antibody, are more suitable for people like that, where they don't have to make their own immunity. You give it to them. And so we're learning more about the best strategies for protecting different people.
Okay, and Dr. Karloff, I'm not sure if you mentioned this earlier for the time frame of the research study. If somebody wants to be a part of it, if they're a busy working mom or busy working dad, how long or how much time do they have to dedicate to this research?
So, first of all, we tried to have flexible hours. We were actually having evening and Saturday hours, but we had to give our staff a break. Okay. But we still have Saturday hours.
Okay.
And so Reverend Hickman can say, so we do try to make things easier. Because of all these careful steps we take, it can take an hour and a half to 2 hours for the especially the first vaccination visits. And at the very beginning, it took us even a little bit longer as we, kind of now we've gotten faster. So you have to spend some time, but there are, not that many visits. So you need to come in to see us for the first 2 vaccines and then another blood draw. And then the rest of the visits are more spread out for the rest of the study.
And I could say that actual first visit where they tell you 3 to 4 hours, it goes by so fast that you don't realize that you've been there for that long.
Yeah.
So it's like you're comfortable while you're there.
And Lisa Henson, I think we talked on this subject a little bit, but do you want to give her an answer for this? How are the vaccines being distributed when you come to like the research and things like that? Just in case Lisa missed that.
Sure. Thanks, Lisa. That's a great question. So the CDC has made recommendations for how the people in the community should be prioritized. So the first was called Phase 1A, and that was healthcare workers, first line medical people like emergency medical technicians, and people in long-term care facilities. And then there are, each different phases as you go forward. So the CDC made these overall recommendations, but it's up to the states to decide if they want to follow that exactly or if they want to modify that a little bit. Our governor has modified that a little bit. But we are proceeding. So it was offered to healthcare workers in long-term healthcare facility. And then it's opening up now to people who are over 75 and essential workers, meaning you work either for the government or education system. And then it'll work its way across until, it's hard to say at this point, but I would say late spring, early summer, that's when it opens up to the general public. So, we'll see. You're really going to prioritize in terms of the oldest people get vaccinated first and people who are essential to keeping us fed and clothed and the electricity running and, all these the food processing industry. So all these essential jobs in the community has also been prioritized.
Yeah. Now, Dr. Karloff, is this going to be an annual vaccine like the flu? Or is it going to be like a one-time vaccine every 12 years? Like what type of schedule? Do we know anything so far?
We don't know anything so far because it's been less than a year that anybody's been vaccinated. And so we don't know how long the immunity is going to last. We're learning more. If you had COVID, how long does that immunity last? And we're learning it might be a little bit longer than we expected, but we're not sure yet. And the same is true for the vaccine. It gives the responses that suggest that it will protect you for a longer period of time, but we have to watch and see. In some respects, people say we're riding the plane while we're building it. We're going as fast as we can. As soon as we think that something's safe, we take the next step, but we don't know all the answers yet.
Okay. Does a person have to test positive for COVID-19 to be in the COVID-19 vaccine trial or antibody study?
No, they don't. We don't screen people. They could test positive or negative. So that doesn't matter, because really, the people who are most vulnerable are people who test negative, because they don't have any immunity. So the vaccine will be most benefit to them, because people who have had COVID have some protection, but we don't know how long that lasts yet. So we're vaccinating them too.
Okay. Now, Reverend Hickman, right? One thing in the Black community is using items that probably do not work to heal, like ginger ale. If you are sick, it's like, go drink some ginger ale and you'll be all right. What advice can you give to people who do not like taking medication or vaccines and go for something else like ginger ale?
Ginger ale is not your answer. Fresh ginger is always good. I think everybody should have fresh ginger every morning when you get up, to help wake up your immune system as well, and all of the goodness, and some turmeric added to it and the like. But that is not the answer. We are talking about a virus that can mutate, and especially Karen can talk more about the spike protein that actually is the part of the coronavirus that actually does the most damage, and causes you to have that capacity where you can't hardly catch your breath and you're coughing and all of this, that puts you into the hospital. And so I think that we need to be realistic. If this was something that chicken noodle soup and ginger ale could clear up, we would not be sitting here having this conversation. We would definitely be talking about something else. But for real, we got to get real and get out of our way and get into the way where we want to live.
Absolutely. I agree 100%. So no ginger ale. Okay.
If I can add to that, so I'm a pediatrician and I know not to fight with grandmother's advice.
Right.
And what grandma says works for, most things go away on their own. And so you can make people feel better with some ginger ale or some chicken soup. But, the other side of this is that when COVID came, we had zero way to treat it. And even the way that we put people on respirators for other problems didn't work. So we were really at ground zero. And in this frenetic way, we now have some treatments. We need more treatments. We have 2 promising vaccines. We need more promising vaccines. If you have COVID and you're young and healthy, chances are you'll do okay. Some people feel pretty bad, but you'll get over it. But in every age group, and as you get older, this becomes even more accentuated. There are many, many people who get terribly ill and who die. And, when you start progressing, those kinds of remedies don't work at all.
Yeah.
I think that they're, the younger generation and even the older generation, we all need to face our fear and really pay attention to that. There's some things that we can, say, oh, this is going to do it. You got a fever, put yourself in a tub of potatoes, white potatoes and onions, and put some garlic up there, and you're still coughing and you can barely get out of the tub. And it's like that. You have to really begin to face your fear. You have to begin to talk to someone about what is so, bothering you, that you just don't want to do what really everyone is saying. Let's go ahead and get this vaccine. Let's go ahead and participate in this trial. Let's live. Let's live, because we want to dance again. We want to make certain that, everybody is in a good space. We want to live. I keep stressing we want to live.
Yeah, absolutely. So, Sherman, I'm so happy you asked part of this question as well. The first part is, can the vaccine make you sick? Does it give you the coronavirus? And lastly, the question that a lot of people want to know, do volunteers get paid for being a part of this research study of COVID-19? Go ahead.
No, I was going to ask you who you wanted to take it. Reverend Hicks.
You can go ahead. Let's talk about first. Let's talk about the money first. A lot of people want to know this. Do volunteers get paid for being a part of the research?
Yes, volunteers do get paid for being a part of the research. There is a staged payment plan where you get for the vaccine that study that I am in. It's staggered over your visits. So to make certain that you're coming back to get that second injection, to make sure that you're coming back to get your blood drawn and the like, and that you're coming back towards the last 24th month to make sure that all of your records are right, you've gotten the final examination. Is the amount of money you're getting actually going to put you in the luxury home? No, you are not going to be able to go downtown to the Pendry and have an amazing dinner and stay the night in the $3,500 suite. So the bottom line is that you really are a volunteer. It is a nice way to say thank you, but reality is that I don't believe that anybody at this moment is doing it for the money. I'll speak for myself. $1,700 is not going to save my life. It's not going to do a whole lot of anything, and for the way in which you get it. But it is a good way for persons in community that, need to be compensated. I think everybody should be compensated, but there's not enough money there to compensate, I believe, the way that the scientists, the doctors would like to do so.
Dr. Kotloff, I want you to answer about, do you get sick from? Before we do that, I just want to give you some details about a very important event going on tomorrow. We can continue the conversation there. Be sure to tune in tomorrow for discussion with Dr. Anthony Fauci, which is so amazing. Everybody loves to hear from him. Faith, Science, and Trust, African-American clergy, and a community conversation on COVID-19. It's a discussion with America's Dr. Fauci and clergy, African-American community, hosted by the University of Maryland School of Medicine. It happens at 2 p.m. tomorrow. So for more details, you can log on to medschools.umaryland.edu/Fauci. Okay, so make sure you be a part of that tomorrow. Dr. Kotloff, do you want to talk about maybe the symptoms and if you get sick from this COVID-19 vaccine shot?
So yes, any vaccine can give you symptoms. You can get a sore arm. Your arm can get a little bit swollen. It can hurt when you move it. It could be red. And then there are what we call systemic symptoms you can get. So you can get some fever. You can get headache, fatigue. They're the major symptoms that you can get. And we know from the 2 vaccines that are approved right now under emergency use authorization that the majority of people get some of those reactions. They are almost all mild or moderate. Just a very few % of people would say this is severe. It tends to last about 2 days and then it goes away rather quickly. And everybody, even the people who got a higher fever or, who thought their symptoms were more severe, I said to all these people, what would you tell your friends and your relatives? Is it worth it to get this vaccine? And I have to tell you, honest to God, that every one of them said, yes, it was worth it. When I'm rating whether I'm going to not feel so well for a day or two versus could I get COVID and potentially die, it's worth it. Don't think that when you get those symptoms, the vaccine is giving you COVID. The flu vaccine doesn't give you flu. You don't get the actual virus in either of those instances. It's just your body's immune response recognizing this foreign little bit of protein. That's what makes you feel sick.
Ladies, thank you so much for everybody who tuned in, and thank you so much for our COVID-19 Research Study in Minorities. Is it safe to learn more about the current vaccine trials at the University of Maryland School of Medicine? And make sure you log on to www.cvdtrials.org. Ladies, have an amazing day. Thank you for doing everything for our community and our culture. I appreciate the time and everything that you do. Thank you so much.
Thank you.
Thank you.
And thank you again to the University of Maryland School of Medicine for this amazing night. Stay blessed.
You
Stay
too.
blessed.
Bye-bye, everybody.